Welcome to another episode of Sisterhood of the Scalpel. I'm Dr. Maryam Zamani,
I'm Dr. Julie Khanna.
and today we want to answer your questions about how is it that we come together and arrive at choosing the right implant size for our patients who decide to have breast augmentation with implants. And that is a bit of a complicated process that we do here, but we take it very seriously, right, Dr. Khanna?
We absolutely do. And a lot of offices will make the decision about sizing on the first consult. And we feel like that's crazy because if you look in North America, the number one reason for reoperation in the first year, and believe it or not, it's around 12%, is to do a size change. To us, that means we didn't talk about it enough beforehand. So we have to help you figure it out as to what you want and then communicate it to us.
The way I say it to patients always is we almost overkill the topic. We want to exhaust the question so that I make you try it on like your Goldilocks. I make you decide on what's too small for your liking, what's too big for your liking. So we find that perfect golden implant size for you. So that afterwards, there's no question about it. It's not, did I go too small? Did I go too big? Because we exhausted all those possibilities beforehand.
Exactly.
So the way we do this, and Dr. Khanna and I have the exact same approach, is that we use 5 different points to make sure that we are getting as much information from you to decide what is the aesthetic that you're going for. So when a patient comes in for their first appointment, what's one of the first things we do, Dr. Khanna?
Well, one of the first things we do before we even see them is our nursing team takes them and they get a Vectra. They get a 3D image. Now, here's something funny. People think that's what we use for sizing, and we don't. We use that to learn about your breasts, to learn about your anatomy, to learn about your asymmetries, to learn about your breast shape and what will and will not work. But we also use it as a preview. And we say, okay, this is you with implants. What do you think? And we pick a moderate, regular, natural looking implant. We can go bigger, we can go smaller. It's not about size. It's about, is this the right operation for you? Let's start there. Then what do
And
we do?
the thing, I'm just going to go back to that. The thing I love about Vectra, because we use it in all kinds of different operations, but one of the things that's unique about it, and you guys will see what we're going to show you in a demo in a quick second, is that you see your body in ways you've never been able to see it before. So we see exactly how your chest wall sits, how much one breast sits more forward relative to the other. And these are really important information points for you to know before surgery, because as much as you think you look at your breasts before surgery, after surgery, you look at them 1,000 times more. So it's important to know where we're starting from. And what we always want to make sure is that, like Dr. Khanna said, it's not about choosing the right size based on Vectra. It's just to give a ballpark image. So we're not talking about oranges and melons. So we just want to make sure that we're kind of in the right ballpark together.
And it does. It can help decide that maybe this isn't the right operation. Maybe what you want is a lift, and we can show that too, which is great. Or maybe what you want is fat grafting. Maybe you want something very, very small and very subtle. So together we can make those choices. Plus, you never look at yourself like that. That's not how you should decide what's the right size for you, because most of us don't have photos like that on the phone all day long looking at ourselves. So it's one piece of the puzzle. So the second piece is when we talk about how big is we measure and we are looking at what is your body. And actually from our perspective, from the surgical perspective, that is the most important thing is your measurements. Because we want to respect your anatomy. And if we go too big, I always say if we go way out here, that looks abnormal. But you know what? A little cookie looks abnormal too. So, it's not about volume. I always say that the volume almost falls out like a serial number. It's about what's the right look for you, and then the volume follows suit.
The other part that we're looking at is we always take into consideration the rest of your body as well. We know that it's not just about what size is your breast. It's how does it sit and how does it look in proportion to the rest of you, to your shoulders, to your hips, to your figure in general, and what is it that we're trying to achieve. So these are all very important things that we're looking at the time of your consultation. Now,
you just said something that was really important about how you hold your chest, because if you tend to be very what's called kyphotic, like inward, or very outward, the same implant's going to look so different on you. So
Absolutely.
we need to at least talk about it. We need to
Mhm.
talk about it, and when we're making choices.
For sure. And there's certain anatomical things, certain things about your body that we can change, but there are certain things that are just the way your body is. And we're not going to violate your anatomy. We're not going to cause issues to try and change those things. So one of the common questions, I'm just going to diverge for a second, is how far are my breasts going to be, right?
Yeah.
That's all dependent on your muscles, on your chest bone, how things are aligned together. And we go over all of these things in exhaustive detail at the time of your appointment to make sure that we have a good understanding of what we can expect afterwards.
So when you
So,
look at measurements and
mhm,
body, that's us kind of taking 1,000 implants and narrowing it down now to about 40. So
mhm.
any of those 40 would fit you anatomically. But what are you looking for? So, Dr. Z, how do we read minds? Because that's so important. How do we help our patients telepath to us what's in their mind's eye?
You know what? I kind of sometimes think that we're teachers relative to our patients, and like any good teacher would give you homework. So
There you
this is
go.
one of the things that actually takes the stress of that first appointment away, is that you, like we said, you don't make that decision on your first go when you first come and meet us. We actually send you away with some homework because now you've started to go on this journey of choosing your breast implant size. And the first part of that homework is you collect photos, because photos speak 1,000 words, right? We want to understand what your aesthetic is. And the best way we can get that is to understand what is it that you like. Words, every patient wants to look natural, right? Everyone wants to look that way. Everyone has an idea of, somehow the C cup is like the golden cup that everyone is after. But we understand that, but that is a very different look for different patients. And so we encourage you to go and scour for photos. Doesn't matter where these photos are coming from. They could be celebrities. They can be, surgical pre and post pictures. They can be lingerie. They can be anything. Try and choose someone when you're looking through for these photos that's of similar build, of similar breast shape like yourself, because that obviously does provide a certain type of context for us. But choose photos and bring us photos you love, bring lots of that, but also bring photos
And
you
photos you
hate,
hate.
because we get the same amount of information from what you love as much as we get from what you hate. We actually do use both of those. So that's a big part of your homework.
And it's really important because Dr. Z just said it, words don't translate always. How many patients come to us and say, soft, round, natural, full? And we
Mm-hmm.
get two pictures. I get Jennifer Aniston for those words. And the next one I get is Eva Longoria. And they say the exact same words. And it's like, but everyone said the same thing. So what's in your
Right.
mind's eye may not be what's in our mind's eye. So communication, that's what this is all about. So the next
Mm-hmm.
thing you're going to do is make a homemade implant. Ziploc baggie, dry rice, shower caps work, old knee-high pantyhose. You're going to make a hamburger patty. You're going to make an implant. Dr. Z, you got an implant? Do you have an implant there? This is what an implant looks like. If you put it like this flat, can you put it in your hand flat? It looks kind of like a hamburger patty. Make that and go too big, go too small, play with your size. Notice your differences between right and left. Now, you're not going to phone us, and I always say this, and if you've heard this joke, just ignore me. You're not going to call in and go, hey, 7 liters on my right, 6 liters on my left, I'll see you in the OR. It is
No.
one more piece of the puzzle that we
Mm-hmm.
will work with you to make the right choice.
Well, that's the next part, is that so you've had a little bit of fun at home. You've gone to try this at home if sides are on, but we actually do bring you back. So we have a very important appointment, and this is universal to all of our surgeries. If you know us here at ICLS, we take your journey very seriously. You have about 6 weeks beforehand, before your surgery, what's called a preoperative appointment, where you meet with our team. You get all the information you need to know how to prepare for your surgery and how to set yourself up for success during recovery period, so it's a breeze. Now, when you're undergoing a breast augmentation with implants, we also incorporate into that a sizing appointment. So what that means is that you meet with Dr. Khanna or myself, and we go over and review all these other data points that we've selected together. We look at your photos, we look at the size that you tried on at home. We again talk about it and look at your measurements, look at your vectra, and then we get to try on the sizers in person in the clinic. So much like this. So we use an actual sizer at that point and we try it on. And again, it's about seeing what looks right on you because a lot of
And
times,
feeling. And feeling.
and feeling
Yeah.
exactly. And we have these really evil three-way mirrors that let you see from all angles what you're going to naturally see. But you see yourself from the side to see how much are you projecting out. You see yourself from the front, how rounded does it look? We even help you bend over to see how much cleavage you achieve with said sizer. Using these 5 points, this is as close as we can get to ensuring that we deliver what's in your mind and what is reasonable for your body. So it's a very collective decision, something we spend a lot of time on.
Well, I hope this was helpful, and there's more Sisterhood of the Scalpel to come. So keep sending your requests and your questions, and we're here for you. I'm Dr. Julie Khanna.
And I'm Dr. Maryam Zamani, and it's been a pleasure speaking with you guys today.